To me, without question, the article I've been looking for, and I see it today in the Washington Post, is now there's very good non-peer-reviewed notes that the virus is mutated. I need to talk about that. It's normal for viruses to mutate, right?
It is normal, and this is a virus that has humbled us from the beginning. We're now entering month 6 into this pandemic, and we're learning about the science all the time. We have to follow the science of this mutation news very, very carefully. But in the meantime, we also have to emphasize prevention and really maximize public health right now, because we still have a situation in this country where we have made advances in treatment but don't have a cure. We don't have a vaccine yet. We need to really double down on prevention, especially as we see the trends rising in so many parts of the country.
I'm not going to impress you with my knowledge of glycine out of Leninger's biochemistry from a few years ago. You did well, I didn't. But what I will say is there is a medicine, there is a science. How do we get politicians to start listening to people like you, or Dr. Hotez at Baylor, or Dr. Fauci running the show?
Well, right now, unfortunately, we have 50 states going in 50 different directions in the United States. You know, the president declared a national emergency on March 13th, and a national emergency deserves a national response. We need more coordination coast to coast, especially in times like this. We have to keep learning from each other. We have to support the states that are going through tremendous burdens right now, particularly places like Florida and Texas and California. And then the message to the public continues to be that everybody can make a contribution to prevention here. So, Tom, for example, with respect to wearing masks, we know that masks not only protect the wearer, but protects others. If I wear a mask, it protects you. So people can make their contribution by following the public health guidelines, avoiding crowds, practicing hand hygiene, wearing masks that can protect friends, family, people around them, people they love, and make a contribution to getting this crisis behind us.
Howard Koh, I don't know how much you've been following some of the, vaccine trials that have been going on in China, but there's a vaccine that is currently limited to military use. Is that something that we should be looking at? Is it something that actually could become fruitful in terms of vaccines? Are countries sharing their common knowledge on how to fight this pandemic?
Well, this is an extraordinary time for scientific collaboration. Every scientist will tell you that professionals around the world are working closely for vaccine development and many other aspects of treatment of this pandemic. So we have over 100 vaccine candidates for which research is ongoing around the world. We are expecting up to 5, perhaps, to go into what's called phase 3 trials this summer. That's the last phase before it gets disseminated up and out into the public. And there's a lot of efforts from the top vaccine scientists in the country and around the world to try to get this done by perhaps the end of the year or early next year. But that's a fast timeline. And so until that happens, this is where the prevention message continues to be so important.
Is there any way of reversing what we've had so far? If you look at the trend in the U.S. but other countries, we've flattened the curve and then it's gone back up. Is it a little too late now to significantly get it back down so that we avoid the number of senseless deaths?
Well, Francine, this is not an easy challenge. These pandemics are very, very tough, and that's why we need as much coordination and unified approaches to this pandemic in this country and around the world going forward. We need more coordination on testing for high-risk populations. We need more coordination and ramping up of contact tracing. We need to get prepared for the fall with respect to PPE and other treatment options if the flu comes, when the flu comes, actually. And so the coordination, the communication, a united plan for the United States is absolutely key right now.